Namo Swastiastu. Greetings and good day to us all. First of all, let me introduce SGD who will present our student project entitled EGFR Mutation of Lung Cancer in this opportunity given to us. Before we begin, first and foremost, we would like to express our utmost gratitude and praise to Almighty God for His paternal blessing that He has given to us, so that we can complete our student project and this review. Additionally, we'd also like to express our deepest thanks and gratitude to Dr. Karek Mulantari, specialist in clinical pathology consultant, for supervising our project, and also to Dr. Herman Saputra, specialist in anatomical pathology consultant, as our evaluator in this student project. We utmostly hope that our student project will be beneficial to many people, not to only us as medical students, but also to all the readers out there. First of all, before we begin, I would like to introduce our group SGD now. First of all, we have Amandeus, Fernandito, Leksana, Iswari, Trifena Lisanias, Celine, Aurelia, Ahmad, Jansen Jayadi, Anak, Agung, Istri, Kosalya, Arini, Viona Mareska, Krishna, Putra, Pramanda, Sherly, Septiana, Chandra, Wayan, Mahatma, Amara, Pawana, and Justin, Lordia Lin. In this student project, especially in this presentation, we will be talking about, first of all, the introduction. Second of all, we would also express our background, statement of problems, purpose of study, benefits of the study, and we will continue into the content where we'll be discussing about EGFR, lung cancer, EGFR mutation and lung cancer, the diagnosis, treatment, and also prognosis. Lastly, we will conclude our presentation and continue on to our bibliography. The presentation will be continued by my friend.
Thank you, Fiona. Now I will presentation our background. The cell receptors are proteins that we can find within the cell or on a cell surface, which its function is for receiving signals. The cell receptors receiving signals by binding with the protein receptor with the protein ligand. The ligand is a chemical messenger that is released by a kind of cell that needs to signal the cell itself or signal another cell. The binding between the cell receptor and ligand will result in cellular effect which can cause numerous changes on the cell, including altering cell gene transcription or translation or change the cell morphologies. The cell receptors are sometimes involved with human pathophysiology. One of the main ways why the cell receptors can be involved with human pathophysiology is because the cell receptors can do its function normally. The dysfunction of the cell receptors could happen because of a defect on the cell receptors that is caused by the mutation within the cell receptor. The dysfunction of cell receptors will result in failure of the normal physiology process which result in disease. Epidermal growth factor receptor is one of the cell receptor that exists in the human body. These specific receptors regulates the cellular proliferation within our body. The cell receptors mutation makes this receptor overexpression, and because of the overexpression of these receptors, it could implicate pathogenesis of many human malignation, including the lung cancer. That's from me. Now the presentation will continue with my friend Krishna. Thank you.
Thank you for the chance, Mahatma. So today I would like to continue this presentation about the statement of your problems. Based on the explanation on the background of the study above, the problems of this study could be formulated as follows. First, what is EGFR? Second, what EGFR mutation role in lung cancer development? Third, how to diagnose the lung cancer that is caused by mutation of EGFR, and then the last one is how to treat lung cancer that is caused by mutation of EGFR. After we know about the statement of your problems, I would like to tell you about the purpose of this study. First, to know what EGFR is. Second, to know what EGFR mutation role in lung cancer development. Third, to know how to diagnose the lung cancer that is caused by mutation of EGFR, and then the last one is to know how to treat lung cancer that is caused by mutation of EGFR. After we know about the purpose of the study, I would like to tell you about the benefits of the study. The benefits of the study are: first, students are able to understand and explain about the EGFR. Second, students are able to understand and explain about EGFR mutation role in lung cancer development. Third, students know how to diagnose the lung cancer that is caused by mutation of EGFR. And then the last one is students know how to treat lung cancer that is caused by mutation of EGFR. That's all from me. This presentation will be continued by my friend Trifena.
Thank you for the chance. Now I would like to open the content with the explanation of what EGFR is. So the epidermal growth factor receptor is a transmembrane glycoprotein that has three major domains: the extracellular binding region, a transmembrane spanning region, and an intracellular tyrosine kinase. There are three major steps in the activation of intracellular signaling by EGFR. So the three major steps is first the binding, epidermal growth factor receptor binding to the specific ligand. It takes place in the extracellular domain of the EGFR. The second step is the dimerization. The binding of a ligand with EGFR causes the formation of a functionally active EGFR with another EGFR or another related receptors, which form either homodimers or heterodimers. This formation causes the last major step, which is phosphorylation, the ATP-dependent phosphorylation of specific tyrosine residues in the EGFR intracellular domain. This phosphorylation triggers a complex intercellular signal transduction cascade to the cytoplasm and then to the nucleus. That's from me. The next presentation will be continued by my friend. Thank you.
Alright, I will continue the explanation about lung cancer. Overgrown tissue can lead to a condition called cancer. Unfortunately, when cancer already spread rapidly through the body, normal tissues can be ruined and the cancer disturb our organ system. Cancer is still a concern in medical issues since it is the second most dangerous disease in the world after cardiovascular disease, which causes death. Lung cancer is an example of cancer type. Lung cancer patients have to seek medical treatments as fast as possible, have their diagnosis checked by doctors, and it is due to their serious condition. The quicker right treatments are given to them, the more possibilities they can get through the disease. Lung cancer usually begins with primary cancer in the lungs, but can be more harmful or risky, we say, when it turns to be secondary lung cancer. Secondary lung cancer means that the cancer spread from the lungs to other tissues. The symptoms of lung cancer is variated, such as hemoptysis, which is bleeding during coughing, feeling tired, losing weight, unstoppable cough, and pain during coughing. People who smoke cigarettes, secondhand smokers, and people who frequently exposed to diesel muffler, arsenic, and radon are people with high risk factors of lung cancer. Treatments given to the patients with lung cancer has to be based on the stage of cancer itself. We can consider the treatment based on how much the cancer deploys. Surgery is determined if only a small area by the abnormal cell growth or cancer. Radiotherapy and chemotherapy are needed when the cancer is in a large amount in our body. That's all from me. The presentation will be continued by my friend. Thank you.
Alright, now I will explain about the mainly about EGFR mutation, and after that my friend will continue to make connection between EGFR mutation itself and the lung cancer. Now, as explained before in the EGFR subchapter, EGFR takes role in inducing signaling pathways to cells, indicating growth of the cell itself. In normal tissue, EGFR ligand activity is tightly regulated to ensure that cells proliferation meets the requirement for homeostasis perfectly. But in case of tumor, a microenvironment is created in which EGFR will get started to produce EGFR ligand uncontrollably, promoting the abundance of cells growth, leading to metastasis. In this microenvironment also, EGFR will likely to experience mutations, making it flux the receptor to make the ligand unable to break free, and then ensuring continual activation of cells growth. After that, it will be explained by my friend.
Thank you for the chance. Now I'm going to continue the explanation. Some lung cancers have been discovered to have a relation with mutation in epidermal growth factor receptor or EGFR. Given that EGFR expression in the non-small cell lung cancer or in SCLC is more than 60%. One of the pathogenesis of NSCLC is because of overexpressed EGFR, making it poor chemosensitivity. The overexpression of EGFR detected as DNA mutation by polymerase chain reaction in both extracellular or intracellular part of the proteins. These EGFR mutations can lead to cell proliferation or anti-apoptosis because of constitutive activation of signal transduction pathway. That's all from me. My friend will continue the presentation. Thank you.
I will continue the presentation about the diagnosis. So, for patients that were previously diagnosed with lung cancer, especially for those who were diagnosed with non-small cell lung cancer or adenocarcinoma, will furthermore be checked for any existence in EGFR mutation. There are several types of EGFR mutations that can be possibly found, differentiated by which exon will become the site of mutation. among 28 exons in EGFR gene. Currently, the EGFR mutation-related lung cancers are dominated by two types of EGFR mutations, which involves either mutation in exon number 19 or in exon number 21. Molecular profiling, also known as gene testing, become the most effective test for diagnostic purpose in EGFR mutations-related lung cancers. A sample will be obtained from patient's body, then the DNA information inside the sample will be analyzed in lab to find out any mutations in EGFR gene. The sample can be informed of either a lung tissue sample obtained from lung biopsy or a sample obtained from liquid biopsy. That's all from me. The presentation will be continued by Matt.
Thank you. Now I'm going to discuss about the treatment that commonly used to treat lung cancer. And there is the tyrosine kinase inhibitor. It inhibits the secretion of tyrosine kinase, an enzyme which triggers the cell division. For example, like gefitinib, acatinib, erlotinib, or osimertinib. Those are types of TKI drugs that have been known as the first-line treatment for lung cancer. For the second treatment, we usually use chemotherapy, and its aim is to kill the cancer cell in a more comprehensive area. However, it is also impacting to healthy cells surrounding the carcinoma cell, thus making its effect is systemic. For the next presentation will be continued by my friend. Thank you.
Next, I'm going to talk about the prognosis. A study in Latin American countries found a high mortality on patients with non-small cell lung cancer and EGFR gene mutation treated with tyrosine kinase inhibitors. The median survival was about 9.3 months. The prognosis of patients with non-small cell lung cancer is undistinguished with standard treatment for about 6 months. The studies also manifest that the side effect profile of tyrosine kinase inhibitors is superior compared to conventional chemotherapy. Next.
Thank you for the chance. I would like to make a conclusion from our project about EGFR mutations in lung cancers. The EGFR is a transmembrane glycoprotein that has extracellular epidermal growth factor binding region, a transmembrane binding region, and an intracellular tyrosine kinase domain, which controls several biological responses. Some lung cancers have been discovered to have a relation with mutations in EGFR. These mutations can lead to cell proliferation or anti-apoptosis because of constitutive activation of signal transduction pathways. Molecular profiling, also known as gene testing, is used for diagnosis purposes in EGFR mutation-related lung cancers. The treatments of lung cancers caused by EGFR mutations generally are using chemotherapy and also tyrosine kinase inhibitors. That's all from me. Thank you.
Right, thank you for the opportunity. And here are our references that we used in our student project listed and displayed as you can see in this slide. And at that, we have reached the end of our presentation. First of all, we would like to express our utmost gratitude for the time and opportunity that has given to us. And also, we would also like to apologize for our mistakes that we have made, maybe during the presentation or maybe during the process of making our student project. Once again, we would like to say thank you and close this presentation with Paramasanti, Om Santi 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 Om. That is all from us. Thank you.